Okay, so let's look at a few bony structures on the leg. So starting up top here, so if you remember, we have our pectineus muscle right here, and that's going to start right here on this. This is the superior ramus of the pubis. I'll fold it down. Superior ramus of the pubis right here. Okay, and then following the pubis medially right here, we have the tubercle of the pubis. Okay, and then this little slope right here that's going to connect the tubercle and this little area where the pubic symphysis would be is that pubic crest. Okay, pubic tubercle, pubic crest. And if we move over here, okay, there's our psoas major, and then iliacus kind of in this area. So that bony structure under there would be the iliac fossa. Okay, up here we have the iliac crest. So if we follow the iliac crest forward to right here, that's going to be our first little spine on the anterior side. So that's the anterior superior iliac spine. Okay, if you notice sartorius, this big long guy right here, okay, sartorius attaches up there on that anterior superior iliac spine. Okay. So this one's kind of, you can kind of see part of the sacrum and part of this L5, this last little lumbar vertebrae right here, and then going down into the little sacrum. Let's see here. So on this opposite side, so we have our gluteus muscles, gluteus maximus, medius, right here, and minimus. So those are going to be attached on this posterior side right here. So this is opposite side of the iliac fossa. This is our gluteal surface. Okay, gluteal surface, that's the origin. Remember our origin for our gluteus medius. And then the gluteus medius is going to insert right down here on the greater trochanter. Okay, and that's going to abduct. That's going to be one of our main abductors of the leg. So it's going to abduct, and then it's going to help medially rotate as well. So then back up here on the iliac crest, if we're going to follow it back here to the posterior side, so right here, okay, this is going to be our posterior superior iliac spine, and if we go down here, we have our posterior inferior iliac spine. And again, here's part of the sacrum, and then kind of going down into the little coccyx right here, the tailbone. Okay. Some maybe bony structures we can see down here. If we look down into this popliteal area, let's see. You can't see those very well. So if we're on the sides of the leg right here, okay, so you can see in here, okay, this is where our femur is. So this is that patellar surface. There's our patella. It's kind of hanging out in there. So the patella just rests right there on that surface. So if we look at the posterior, or if we kind of look at the side right here, okay, we're on the medial side of the leg. So this whole bone right here is going to be the medial condyle, and then just kind of right here in the middle, you'll have your medial epicondyle. Okay, if we bend the knee open a little bit like that, okay, we're going to see down in there, we're going to see our anterior cruciate ligament, okay, and you can kind of see right there where it's starting to form that intercondylar notch of the femur, okay, and so kind of here, if you can see down in there, there's the anterior cruciate ligament. Behind that, you can see the little intercondylar eminence of the tibia. You can see that down in there. Then we have our condyle of the tibia. Okay, this big tendon, this patellar tendon, it's kind of the tendon that extends from our quadricep muscles. It's going to come down right here and insert on this bump right here. So that's the tibial tuberosity. Okay. Let's see, some basic things down here. You can see obviously the medial malleolus, part of the tibia that's going to, our tibialis muscles, tibialis anterior and posterior, are going to hug that muscle, or going to hug that bone right there. So you've got, let's see here, this one's kind of harder to tell, but the main heel bone, this big bone down here, is going to be our calcaneus. Okay, the main bone that articulates right in here, that articulates with the tibia, is going to be our talus, or talus. Over here you've got your lateral malleolus, part of the fibula. Okay. That's pretty much most of what you can see right here. That's going to be your navicular, but that's going to be a little bit more tough. Just remember, a lot of the bony structures that you'll see on the leg, you can see them, but we're going to have a skeleton available inside the room for the midterm, so you can always refer to the skeleton if you're having troubles. Okay, so let's look at a few bony structures. On the arm here, okay. So first of all, an anatomical position. Okay, we've got thumb side, pinky side. Okay, so an anatomical position with the arm. Okay, the pinky side is always the medial side. Thumb side's always the lateral side. So if we're following that up onto the humerus right here, you've got this huge bump that sticks out. And this is on the medial side. That's going to be the medial epicondyle. So that bone is always protruding out pretty far, a lot farther than the lateral one. Lateral one you can't really see as much. It's just kind of flat right here. One thing to take note of, this, so we have the lateral epicondyle on this side. Notice that all of our extensors going down the arm right here, all of our extensors are actually coming from this lateral epicondyle. They're coming from this lateral epicondylar area. And then same with this side, we have our medial epicondyle, and all of our flexors are kind of coming from this side. So if we had a specimen where the hand's kind of chopped off, you notice this medial epicondyle, it's pretty prominent. Okay, that's where our flexors are coming from, so you can kind of know that this is the medial side of the arm. And then on the back, posterior side, we've got our big olecranon process, part of the ulna right there that's poking out. Okay. And that one, the olecranon process is usually lined up pretty well with this little muscle in here. Okay, that's going to be our flexor digitorum profundus. And then on either side of the profundus we have our carpi ulnaris, so extensor carpi ulnaris and flexor carpi ulnaris. Okay, and then over here, more on the extensor side, is where our anconeus is, because that's actually going to help extend the elbow slightly. Up in here, let's see, this one actually has our deltoid removed, which is nice. So we've got this bony, so we've got this tendon right here. Okay, this is a big long tendon. This is actually the part of the long head of the biceps muscle, and that's going right in between two bony structures right here. Okay, so this is going right in what's called the intertubercular groove. So on one side you'll have the greater tubercle, and then over here you'll have the lesser tubercle. Okay, so greater tubercle is always more lateral, and then you have this lesser tubercle that's a little bit more medial, which is actually kind of when you're in an anatomical position, that lesser tubercle is just going to be facing anteriorly. So again, there's that tendon kind of splitting right in between inside of that intertubercular groove. And then we can kind of rotate the arm out a little bit, and you can see kind of the head of the humerus in there a little bit. That's going to be in that, sticking in that glenoid cavity or glenoid fossa. Working down a little bit, kind of this more thin area of the humerus. Okay, that's going to be that surgical neck. Surgical neck, kind of moving into the main shaft of the humerus. Okay. Okay, we obviously have our clavicle. Okay, this one's kind of poking out. So this end that's articulating with the scapula, that's our acromial end. So here's our scapula on the back. This is that medial side, medial border. Okay, medial border is where the rhomboids come off of, and rhomboid major, minor, and then the levator scapulae, they're kind of coming off this medial border in the middle of the back. So we see this big guy right here, that's the spine of the scapula. Then we have our acromion process, and then we have our clavicle over here. So we kind of have that horseshoe-shaped area. That's sometimes called sac. So you have the spine, acromion process, clavicle, so sac. And that's going to be the insertion point for our trapezius muscle, and also the origin of our deltoid muscle. Okay, and then don't forget that right here, so we have serratus anterior, okay, and remember that kind of, that blankets the scapula, okay, and the other scapularis muscles. So underneath we have our subscapularis muscle, but this one is always going to kind of lay on top of the subscapularis. So kind of pay attention to the size of the muscles. So this muscle is obviously, it's kind of like a big blanket muscle. It's obviously bigger than the actual scapula. So if we look underneath and notice, so subscapularis right here, okay, these muscles that are right on the scapula are almost cookie cut out. They're like cookie cut out to fit specifically on the scapula. So that's our subscapularis down here. Teres major is kind of hanging out right there. And then again, just to show you how that works on this other side. Okay, so infraspinatus, nice perfect shape for that infraspinous fossa. Okay, there's teres major again, and then we also have teres minor. Okay, I like to look for this long head of the triceps muscle that's coming right in between these two teres muscles, and that teres muscle just kind of looks like it's like a mouth just kind of chomping on that little, or that long head of the triceps. And then up top here, we have supraspinatus, and again, that's just like nice and cookie cut out to fit right in that supraspinous fossa. So, looking at some of the facial muscles, okay, just keep that ear covered. So the first two that we have, okay, are going to be just kind of on the forehead right here, and they actually extend up a little farther, but as you can see, this one's kind of cut off, okay. So these are going to be our frontalis muscles. So try to think of the bones, like the frontal bone, and things like that. So they're going to kind of follow that pattern. So you have the frontal muscles right here, frontalis. Okay, then over here on the side, we'll just pull this off. Okay, then over here on the side, okay, this is the temporal regions. This is going to be our temporalis muscle. So here on the posterior side, we have our occipitalis muscles. So you can kind of see they're kind of on these more lateral sides. Okay, and then kind of extending up onto the head. Okay, we have this big blanket kind of sheath that's going up on top, and that's our galea aponeurotica. That's going to go across the whole top of the head. Okay, let's look at some of the major face muscles. So I'll pull this guy over here. Okay, so we have our orbicularis oculi, so orbicularis kind of making like an orbit or a circle, and then oculi refers to the eye. Okay, so we've got this circular muscle kind of going around the eye, so orbicularis oculi. Okay, then corrugator supercilii, so you remember the bony structure, we have our superciliary arch. Okay, so that muscle is going to come up right here. Okay, so that's kind of going to follow our eyebrow a little bit. So it's a little bit different than our orbicularis oculi. It's going to actually be kind of deep to that. Let's see if you can see it a little bit better on this side. So you can see it maybe a little bit better on this side, kind of right in there. So this orbicularis oculi has mostly been kind of cut out, but you got this muscle kind of coming up right here. So corrugator supercilii. Okay, then we have our nasalis muscle. So kind of the muscles coming down on the nose. Okay, right here, kind of on the sides. Also on top a little bit. This one's obviously cut away. Then we have levator labii superioris. Okay, so that muscle is going to be a little bit, it's going to be nice and lateral to the nose, and it'll be just right in here. It actually kind of makes an L shape. So you have kind of this little part that comes down right here, and then you have kind of this part that kind of extends over right here a little bit. Levator anguli oris. Then you have zygomaticus. Okay, so zygomaticus kind of comes from the corner of the mouth and is going to extend out right here. Okay, so those will be a little bit longer. Our masseter muscle. Let's see if this guy's got a masseter muscle. Okay, so our masseter muscle, if we look on the side right here, okay, this muscle is going to be this big guy right here. And again, up here, we kind of see the extension of our zygomaticus muscle. Let's see if I can fit this back on. So from the corner of the mouth and coming up right here to that kind of that zygomatic arch area. So you've got this long muscle, that's a continuous muscle. Okay. going to be our zygomaticus. So we've got right here, that's going to be our masseter muscle. And so when you like clench your jaw, when you bite down your jaw, it kind of pokes out on the sides. Okay, kind of close to the ramus of the mandible. And close to the angle of the mandible. So that's our masseter. Okay, then the buccinator or the buccinator. It's going to be a little bit deeper. Let me see if I can find it on this other side. There we are. So I need to cover this thing. Covers the ear. Okay. So here was our masseter muscle. And then right here is our buccinator or buccinator. Okay, so think about like when you make a fish face, those little corners of your face go in, okay? And that's where your buccinator or buccinator muscle is. Just like right in those little dimples when you make the fish face. Okay? Then we have our pterygoid muscles. So the pterygoid muscles you can't actually see unless you go a little bit deeper and kind of cut into the jaw area a little bit. So we've kind of removed the masseter and actually part of the jaw to get in there. So the one on, I'll show you another specimen that's a little bit better too. But you can see we have this muscle down here and this muscle up here. Okay, so the one on the bottom is going to be our medial pterygoid muscle, and then the one on the top is going to be the lateral pterygoid muscle. So I always remember like you have to climb a ladder to get to the top. So the lateral pterygoid muscle is on top. Looking at this specimen right here, this one's a little bit nicer. You can see it nice and clean right in here. So there's the medial pterygoid muscle right there, and there's the lateral pterygoid right there. So they kind of run obliquely and attach to each other, kind of make a little check mark or whatever kind of shape you want to look at. And then here's kind of a cool view from the posterior side. From the inside of the face. So that's going to be the medial pterygoid right there, and then lateral pterygoid on top. Same with this other side. Medial pterygoid, lateral pterygoid. Okay. Okay, then we have orbicularis oris. Okay, so orbicularis, again, circular muscle, and that's just going to be this muscle that surrounds the mouth. Okay. Orbicularis oris. Okay, so now we're going to look at our anguli muscles. Okay, so we have a depressor anguli oris, so it's going to depress our mouth, and then we have a levator anguli oris. Okay, and that's going to elevate the mouth. So if we look kind of deeper right here, so here was our zygomaticus right here. Here's orbicularis oris going around the mouth. Okay, right here we had our levator labii superioris. So deep to all that, just kind of down in here in this little area, right here. Okay, this is our levator anguli oris, going down right in there. Okay, so I look at the corner of the mouth and I kind of draw like an hourglass down this way too, and those are our anguli muscles that kind of make an angle with the mouth. So this is the levator anguli oris right here, and then down here this one actually makes a nice triangle, kind of like the hourglass. That's our depressor anguli oris. Then on top right here, you have kind of this muscle that makes a little rainbow over the chin. That's going to be our depressor labii inferioris.
And then go to the lumbar spine.
And then we have our mentalis muscle. It's going to be right on top of the chin right there.
Oh, that's right here.
Okay, again, this is a good view of the masseter muscle. And you can kind of look down in there, see those nice pterygoids, medial and lateral pterygoid muscles. Okay, just a couple bony structures to look at on here. Okay, so you can see a nice view of a vertebrae right here. So down here you're going to have the body of the vertebrae. You'll get kind of the transverse processes here on the sides, spinous process coming up right here. You can see the little pedicles right here that are connecting the body of the vertebrae with the rest of the vertebrae there. And these areas right here would be going into the laminar area, so the lamina. And then this big open hole where the spinal cord is going is that big vertebral foramen. Got a couple of things right here in the top of the skull. Okay, we've got the big sphenoid bone all the way around here. We've got the sella turcica, kind of in the middle right here, the lesser wing, and then the greater wing right there. You got the petrous part. Got kind of your internal acoustic meatus Let's see if we can get some better light. Can't really see. You got your internal acoustic meatus. You got a little nerve coming out right there. So remember to touch up on the bony structures inside there. So looking right here, so we've got our platysma, kind of these big thin muscles that kind of fan out right here, the most superficial there on the neck.
What's this guy?
Okay, we're gonna look under platysma to kind of look at some of these other muscles.
Yeah.
Okay, so we've got this guy that's going to connect over to the shoulder and then right here on the hyoid bone. So that's going to be omohyoid. So omo is actually kind of the Latin root that refers to the shoulder. So omohyoid. Okay, then these next muscles right in here in this middle area. Okay, we're going to name them from inferior to superior, okay, just based on where they're attaching. Okay, so these ones right here are attaching from the sternum. They're going from the sternum all the way up to this hyoid bone right here. So that's going to be sternohyoid. Okay, so we've got these two in the middle, sternohyoid. And we've got these two just laterally to that, and those are going from the sternum up to the thyroid area, so sternothyroid. Okay. Then a little deeper right here, we've got these muscles right here, kind of on the larynx. So that's going to be our thyrohyoid. Okay. Then under here, under the chin right here, we've got our digastric muscles. Okay, digastric muscle. So digastric actually has this head that goes right here, and then we actually have, see if you can see down under there. So we've got this head that goes right here, and then one that goes all the way back, and that's going to go all the way back to the mastoid process. Okay, it's going to go all the way back to the mastoid process. And then under here, okay, we've got our mylohyoid.
And you have your medioclavicle.
Okay. Then these big main guys right here, sternocleidomastoid, so they're going from the sternum to the clavicle and sternum and the clavicle to the mastoid process, sternocleidomastoid. Then we have our scalenes, which are going to be kind of our deeper neck muscles.
But it's usually on the dissect.
Yeah, these ones aren't too bad. So these are going to be our deeper neck muscles. So you see right here, right here, okay, and then back here. So you've got 1, 2, 3 scalenes. Got like an anterior, middle, and a posterior scalene.